The 23rd. Dr. Dobbs will give us a full report here in just a few minutes about our numbers. He and I have both been studying the daily reports that come out on hospitalizations and capacity issues. We did have relatively good news today compared to the last 2 days, with slightly less than 1,000 new cases reported. We did, however, have 13 new deaths reported today. And as we have said throughout this process, we all agree that one day certainly does not a trend make, but the hospitalizations are also steady day over day, which is certainly not a sign of success, but it is a sign of hope. We certainly want to see stabilization in total number of cases and also in hospitalizations. We're a long way from saying that's actually happening, but today is a better day with respect to that than yesterday was. I do want to be clear with everyone across the state. We that are sitting at this table that have been raising the alarm over the last 3 to 4 weeks are not trying to induce panic. We are trying to make sure that there is a healthy respect throughout this state for this deadly virus and this deadly threat. There were times in this pandemic when fear was really over the top. Now, the pendulum has really swung, it seems, in which we have too many people who are acting as if this virus doesn't exist. They're acting careless. They're acting as if they're only worried about themselves, they feel like they can beat the virus, and so why does it matter? I want to just sum up for those of you across the state as to why we are being so forceful in our honest analysis of where we find ourselves. So many want to talk about survival rate. That is, if I get the virus, am I likely to die? And we all know that the survival rate for this virus is certainly better than the 5 or 6% that it looked like early on. But we also know that the survival rate for this virus is significantly worse than the common flu. But I also want you to know, whether it's 0.25% or 25% survival rate for you as an individual, survival rate is not the only issue at hand. We have to also focus not just on the survival rate for each individual in the state, but also on our healthcare system as a whole. I would tell you that the category, and this is a 19-page report that the department does virtually every day about hospitalizations and other things. If you look at this, and I will tell you, I spend hours every day looking at these numbers. If you look at the categories of individual Mississippians who are contracting the virus today, and the categories that are growing the fastest, it is those younger individuals. It is those under the age of 30. It also happens to be those, by the way, that are in their teens. We're seeing significant increases in the number of cases amongst those 15 to 19. Certainly, the largest category of total cases are those between the ages of 21 and 30. And there is no doubt, while it can be very dangerous to that category of individuals, their survival rates are far greater than someone who's over the age of 80 or over the age of 90. But when you look at it from our perspective, we don't just look at it, what does it mean to you, the first iteration of an individual who contracts the virus. While that's important, it's not the only thing that is important. It's when that 27-year-old contracts the virus and then goes home and gives it to a mom or a dad. Well, maybe that mom or dad is going to be perfectly fine as well because they are healthy. But what happens if that mom or dad is a primary care provider in a nursing home and they take the virus because of this community transmission into that nursing home? Unknowingly, by the way, nobody is intentionally spreading the virus, or at least no one halfway sane is intentionally spreading the virus. But this is the iterations that we're dealing with. The young person gets the virus. They go home because they live with their mom or their dad. They give their mom or their dad the virus. Then, in the third iteration, the mom or the dad goes into a nursing home and gives that virus to somebody who's 75 years old, 85 years old, whose mortality rate is very different than the first person who got it. And so, I just want to be clear that when we are talking about the dangers of this virus, we are not focused on an individual 21-year-old survival rate. We're focused on our healthcare system as a whole. Because I can assure you that when all is said and done, when we get a vaccine, and we will, we're the greatest country in the history of the world, we will ultimately find a vaccine. It's not going to be me, but it's going to be the scientists in American pharmaceutical companies that come up with a vaccine. When all is said and done and we look back at the virus, we may find that the survival rate is much higher than we originally anticipated. But when we are talking about protecting our healthcare system, 10 years from now, when they look back at the survival rate of this virus, they're not going to take into account someone who was in an automobile accident that could not get the highest quality of care because there were no ICU beds available for that person in an automobile accident. And so as state leaders working with our hospitals and our healthcare space, we have to do everything we can to protect the integrity of the healthcare system so that everyone in our state that needs quality care, not just those who have COVID, but every single Mississippian can get that quality care. I've been accused of a lot of things over the last 6 months. Quite frankly, I've been accused of a lot of things over the last 17 years, and I'm used to it and I'm okay with it. But understand this, there is no incentive for me to sit here every single day and spread irrational fear. It would be far more popular and far more advantageous for me to get up here and say, you don't need to sacrifice at all. Everything's going to be just fine. It would also be a lot easier for me to get up here and make the popular decisions that so many other states have made to implement this or implement that. If every other state's doing it, then we'll just do it and we'll see what happens. But that's not why I ran for governor. I ran because I wanted to do everything in my power to make the hard decisions to make Mississippi a better place. And that's exactly what I'm trying to do every single day. I believe that what we are doing is the best path today to prevent more deaths in our state than have to occur. We're not going to stop the spread of the virus. We cannot eliminate all future deaths, but we can do the little things as a people by wearing a mask in public, by staying socially distanced, by avoiding large groups. If we'll do those things, I think we can make a difference. I do want to say to the people of our state, we are seeing more positive signs that you are taking this seriously. I want to congratulate you for that. I'm hearing more anecdotal evidence every day of healthcare workers who reach out to me and say, I can't tell you how much better I feel today because I went in a retail store and I was not the only one in there wearing a mask. In fact, everyone in there was wearing a mask. Our people are now paying attention again. I think that's very positive. We've got more work to do, But I do believe that our increased focus can and will have an impact. If we can get our citizens to wear a mask in public, to do the little things, we can slow down the spread of the coronavirus. Dr. Dobbs, will you give us an update on our numbers?
Yes, sir, of course. Thank you, Governor. So today we're reporting 982. It's kind of shocking when that seems like it's a good number. Still almost 1,000 cases reporting today. We are reporting 13 additional deaths. If we look at our hospital capacity, we see ongoing strain in the healthcare system. Our total hospitalized patients with confirmed coronavirus is 975. We've had a mild drop in our total ICU use at 278, but an increase in patients on the ventilators up to 163. Again, the ICUs are filled about 40%, essentially with COVID patients. So a big proportion of that is certainly straining the healthcare system. We have 8 hospitals with 0 ICU beds, but I would like to say thank you to the health systems and the hospitals across the state who are working very diligently to add additional intensive care space for you and your families. We've seen them add more beds online so that there's care available, but this is really a strain. You know, it's kind of like when you have to work 80 hours in a week when you're not used to working that hard. I mean, well, no one should be used to working that hard. But you know, it's something that's going to be hard to sustain. But I would like to thank them for bringing those beds online to take care of sick Mississippians. The other thing I'd like to say is with testing, please remember that if you need to get tested for coronavirus, you can use one of the no-cost state options. We still have the daily testing Monday through Saturday at the Old Farmers Market on West Street, so you can call and get an appointment if you need one. And today we have additional testing at Lexington and Tupelo. Tomorrow we'll be in Brandon and Heidelberg, and then on Saturday, South Haven and Pontotoc. So if you need to get tested for coronavirus, remember that that's an option for you if you think you might have been exposed or if you have absolutely any symptom of coronavirus. Thank you, Governor.
Thank you, Dr. Dobbs. This time I'm going to turn it over to Director Michelle.
Thank you, Governor. Just a couple of things I want to bring up. With regard to public assistance for COVID, as you've heard me talk here over the last few press conferences about the COVID Emergency Relief Fund, public assistance, which is open right now for counties and municipalities to make application on that. FEMA is going to be providing some online webinars for training for those counties and municipalities that may not be as familiar with how to file application under public assistance. Starting on Monday and running all the way through Friday on each day at different time zones, different times, FEMA will be providing Zoom meetings on topics such as grants portal application basics, COVID-19's applications overview, and emergency protective measures and donated resources. Those things will be provided. My communications department will list those on our website. Those will be listed by Friday, and you can go on and look at that and when those times are, and then the link for those Zoom meetings will be available. For those of you that can't make the scheduled times, there will be an on-demand YouTube videos that you can go in and capture those videos at your leisure. Just a tropical storm update. As you all are aware, the main storm that we've got the storm that we've got our eyes on right now, Tropical Storm Gonzalo. Things you need to know about this storm. This storm is moving out of the Atlantic into the Caribbean basin, and will do so over the course of the next few days. It's expected to be just in the vicinity, just southwest of Cuba on or about Monday. The storm also is a relatively small, compact system, which means it is going to be susceptible to environmental conditions, either both good or bad, depending on what those environmental conditions would be. So we're going to continue to watch this. This could be our first hurricane to enter the Gulf. We hope that is not the case. And because of that, I just want to remind everyone about the sheltering operations during a COVID environment. Sheltering operations, sheltering spaces are going to be extremely limited, more so this year than they were in seasons past. I want to remind everyone to plan early, to evacuate early out of the zone, and to make arrangements with friends or families or in hotels to evacuate so that you can stay out of congregate shelters. And we will be providing additional information next week about non-congregate sheltering processes and a way to get assistance to be able to do that. And then final note, I just want to thank the companies in Mississippi for coming to our aid and continue to provide us support. They come to us every time we need help. They're always there, and discussions as late as even 8, 9 o'clock last night with people that are helping us. So thank you very much for those companies in Mississippi that have stood beside us and been great partners. Governor, that concludes my update.
Thank you very much. I just want to give you one number, which I think probably better than any other illustrates what I was talking about a little earlier about the iterations of this particular virus. You may recall that we sat here after having a conversation with the presidents and the White House Coronavirus Task Force, and we put forth an initiative the last 2 weeks of May that over 14 days we were going to test every single employee and every single resident of our nursing homes and long-term care facilities across the state. Now, that was a monumental task that I tasked the Department of Health with. And now their partners at MEMA and their partners at our fantastic Mississippi National Guard, they developed a plan, they went to work, and within 14 days, they were able to get that done, just as we had asked them to do. What we found, and it was approximately 30,000 tests that were run, and because of that, we were able to reduce the number of outbreaks in long-term care facilities in Mississippi to a number that was less than 100, and I believe it got all the way down to only 85 statewide. Since that time, that number has doubled. I just looked on the website. That's what I was doing, was looking at my phone, looking at the data. We now have 170 outbreaks in long-term care facilities. We can look at the data. We know that someone who gets the virus that is over the age of 70 is much more likely to have a negative outcome than someone who is younger. But we had tested everybody. So by the end of May, we had tested everybody. And so those who had tested positive, we had been able to isolate them. But when there's community spread, the employees get it from someone else, and then it gets back in the facilities, and that's going to lead to negative outcomes for some of those residents. It's just, it's unfortunate, but it's inevitable. And so that's why everyone working together to slow the spread is critically important.